Let's talk about the symposium. We were supposed to have a physical one in Park City, and COVID killed that. So we're doing a virtual one. And, I'm honored to have you and others talking in this symposium. And we all share one thing in common. We believe that measured matters, right? If nothing else.
That's right. Yes.
Yeah. So tell us about yourself. Tell us what's going on.
Well, my name is Salvador Romero. I live in the north part of Mexico in the state of Chihuahua. And one of the things right here is that I live in the border between Texas and my state, Chihuahua. And the big advantage that I have seen with all these measure matters is that I have had the opportunity of being checking every patient since the beginning all the way to the end of treatment. And it's not just orthodontics or moving teeth. I think that I have incorporated, thanks to all these devices and computers, so I have been able to analyze the TMJ, the muscles, the occlusion, and it's just helping me out to get better results on my patients. The patients are more stable, and that's one of the biggest concerns in orthodontics, the relays. So we're seeing more stability on the cases thanks to all this measure information that I'm just getting into my patients. Thank you very much, Nick.
You bet. You're doing traditional braces. You're doing aligner therapy, right?
I'm just crazy because I started since 2002, and I started with this concept of aesthetic orthodontics. And since 2002, I have been using Invisalign. I have been using lingual orthodontics. At this moment, I have been incorporating everything, lingual, aligners, and normal braces. And
you're doing tats too, aren't you?
Yeah, a lot of tats on my clinic.
Yeah.
I'm using the MARP system. I'm doing surgery cases, and in some other cases, thanks to the tat and the MARP, the internal expanders, I'm doing things that I was never thought that I was going to be able to do. And all this information, I just incorporate with the information of the T-scan, the GVA, now with the cone beam, the tree shape, everything has been there together just so I can get more information and better results on my patients.
Yeah, it's an honor to know an orthodontist that does all that. It takes the time, cares enough.
Thank you. I'm crazy about all this. Sometimes I think that it's not about the money. It's about that you just think that you can do things better, and you can do you can get good results to your people or to your patients.
Yeah, I think that's very fair. All right. Well, thank you very much. And what do you want to tell the audience about the symposium? Are you excited?
Yeah, I'm very excited because we are going to see top of the. I definitely think that these are top doctors. Everybody that you have invited right here. I admire a lot what is Jorge Legarreta from Argentina and Marcelo Matos from Brazil doing. I admire a lot what you are doing at this moment in Arkansas, Nick. I have been in your clinic and I have seen the way that you work, and I think that you are some goal that we have all to get there. You are a gold standard for everybody.
Silver standard at best.
And having there Robert Kirstein, everybody that is going to be there. I'm very excited to be just sharing what I know, and mostly what I'm going to learn from all of them, because this is about learning. And I think that we are just learning and then learning more information and learning more information. Yeah. And I know that we are on the right track. And I know that we are going to be in a better track in the future when we just start sharing all this information and complaining just being like a group or like a team.
A network. This is a network. The CNO is a network.
That's right.
Yeah.
So I'm very excited about this because I'm learning a lot every day with you guys. A lot.
Well, we're learning from you too. You're our ortho end of it, man. You got to keep us up to date on the ortho stuff, okay?
Yeah, of course. Thank you very much.
All right, man. Thank you.
About my presentation, it was about braces and aligner therapy, measuring occlusion digitally. with the T-scan linked to electromyography and 3 shape. And one of the things right here, well, this is some of the places that I have been lecturing. Most of them it's about orthodontics, and thank God I have been having the possibility of showing the efficiency with working with TMJ, with the occlusion, and working with muscles. So I think we all think differently, and that's the thing that I'm changing at this moment. I'm learning, I'm taking away old ideas, I'm bringing new ideas, and now I know that it's happening to me every month and every year. And sometimes you go one direction and sometimes you go the other one. If you take a look at the subway, you can go forward or you can you can go backwards. So this is the direction that I'm taking right now in the office. And the first thing that I have seen in my practice is that I have been working very hard with the occlusal plane. And the posterior occlusal plane is one thing that I have been learning a lot in the last couple of years, because it's helping us on the develop of the mandible and helping the class 2 patients to remove that compression of the condyle into the TMJ. And that way we can just change that occlusal plane and we can just help our patient physiologically, that I have been seeing this kind of big advantages on my patients from Japan, from Sadao Sato, and people from Vienna, from Austria. And they are involved on all this posterior occlusal plane. And in the United States, about 40 years ago, a doctor called Ricketts started just thinking about this idea of the occlusal plane too. So he didn't have a lot of research about this, but he was thinking and he was putting on this information on the books about the change of the occlusal plane. We got the Bomer, that it's very important because it's just part of the angulation of this posterior occlusal plane. This occlusal plane at the beginning, and then how it started just to be flatter. So you can get into a good relationship, class 1 on the molars, class 1 on the cuspids, but mostly with uncompression on the TMJ, related with people just from Colombia and from Japan that are being just studying the importance of this occlusal plane, the development of a class 2 and a class 3. For example, right here, we got the occlusal plane on a class 2, the mandible goes a little bit to the back. There's more compression on the condyle. And the difference between a class 3, when you get uncompression on the joint, and you get a flatter occlusal plane. Deviation do we have from the right side to the left side? Sato in 1987. That a class 2 development, it has the problem that there is an inner rotation of the temporal bone, is compression of the condyle, vertical elongation of the maxilla, the elimination of the interference. The first thing right here is that I was trying to get, we got a underbite on the anteriors. We got a class 3 development. So the first thing right here is that I wanted to treat it, Ricardo, just by first developing everything to a class 1, and then just taking advantage of the TATs, the mini implants. And that way I can get the protrusive and the lateral movements, so I can just get Ricardo into a right position. Mini implants on both sides. Here we have the buccal shelf on the right side and on the left side. We are using the TATs directly to the ball hook on both sides, and we are causing the pressure so we can get a class 3 development. Prescription that I am using at this moment, self-ligating bracket. I'm using the TAT at this moment. I'm using 50 grams per side of force, lateral movement between the cuspids from the left side and the right side of the joint. Here we start making adjustments with the T-scan, the electricity and checking the voltage so I can get a good reaction of the electromyography. Decided to build something that it is called orthosis, or the maxillary anterior guide orthosis. We told him that it was going to be, he was going to be on this guard treatment for around 3 months. And we just drop down all this vibration and this pain that he was having on the TMJ. More information, the open bite, and obviously we want to make a lot of changes on closing that bite. Here is the blue sky planner that we use a lot on the patients. We just scan the teeth and we decided how many millimeters we are moving at this moment. That's what we are doing today. Partial disc displacement reduction, mostly on the right side. And the other one is just close to a normal situation on the TMJ. We are checking the difference between the protrusive movements, and this is the elastics that we are using on Cassandra at this moment. We took a tree shape so we can just measure at the end of treatment what do we have to change. And here was the beginning of this anatomy of the condyle on both sides. But we have uncompressed that condyle, so there's going to be a huge change on the next years on this condyle because it's going to start rotating and translating the correct way. Here is the measure of this condyle. We have an equal bite. Then we took the protrusive and lateral movements on her.
On the CT images, her cortical bone around the condylar head was intact. That white fuzziness was beautiful. When you were going in the coronal view in and out, I saw this beautiful like eggshell on the superior aspect of the condylar head. Yeah, this view. What you're doing is absolutely amazing. And dude, my hat's off to you. I mean, and I sure as hell don't know it all. I don't think the surgeons know it all. I'm just trying to give you an idea of what I've learned over the years. And I'm not an orthodontist. I do not have your training. I'm not even being critical. I'm trying to make us all better.
Yeah, right? Perfect. Thank you very much.
Yeah. This is not, I think this is one of the most amazing lectures like I probably have ever seen. Wow.
Obviously, we don't have any information on the GVA.
No. Yeah, no. See, you got to have to take the JVA with a grain of salt. I mean, the JVA is amazing, but it's a screening tool.
Yeah, that's right.
Yeah.
And this is the way that I'm planning to move them.
So was she your patient before she had hit the jaw or not?
Yes, but the thing right here is that I was in a Congress. So the accident was on a Saturday and they had to just bring her to the hospital.
Did she have an anterior open bite before?
I'm opening the bite at this moment because I am just changing the plane on her, the occlusal plane.
Got it.
So we got biplane so we can get a little bit of uncompression on the ligaments and on the condyle.
Got it.
Oh, with one hand, she can put the elastics.
She's talented.
Yeah, so I just took video because some patients tell me, I can put the elastics. So I said, you know something, let me just take the video of you.
That's awesome.
Okay.
That's awesome. Man, this is awesome.